Joe, you're there. I see you. There, he's
Oh, yeah.
coming right there. You've been here all day. Thank you. We appreciate it. And now
Well,
we want to hear for what you all are doing. It's amazing.
It's a good thing I have a pretty good image of myself, because I feel wholly inadequate after listening to the geneticists and the oncologists and the survivors today. It's really been pretty amazing stories, and the work that everybody's doing all over the world, that is just fascinating to me.
But look what you can pass on to all the women and men that you're going to help now, that you have been helping.
That's what I was about to say. So, and I've been texting with some of my oncologists and radiologists that are on our board and that we deal with every day. Most specifically, what Jay was just talking about, and one of my oncologists said, I preach that to my people every day. So, they're out there doing that. So it's neat. There's a lot of synergy here. And if I can share I'll be quick, because literally I don't think that I don't hold a candle to any of this, but I'll tell you what we do briefly. Breast Cancer Foundation of the Ozarks started 20 years ago. And let me just see if I can start the slideshow. I'll just go through this really fast. There we go. That's us. We do a very small group of people, but we provide help and hope. Most of it is through financial assistance. We are a hyper local organization, but we work with breast cancer screening rates, and then we also do financial assistance. I don't know if you can see on the right side, I have to move my picture, but most of you probably are familiar with O'Reilly Automotive. They have stores all over the country, and Mary Beth O'Reilly is the matriarch of that family, and she lives in Springfield. In fact, in Springfield, you'll find several people that you might recognize. The owner and founder of Bass Pro Shops is from here. So Mary Beth essentially was a breast cancer survivor in 2000 and started this organization to help women who were falling through the cracks and weren't getting assistance from other organizations. So we call it local help for local people. It started in Southwest Missouri. It's moved into a very big chunk of Northwest Arkansas, which includes Walmart's headquartered area. But we do a portion of Oklahoma and Kansas. And again, it's financial assistance, non-medical is what we do. We pay to invoice. And that figure is old. We're probably closer, I think we crested 8 million in assistance this year. And that's just money that we've collected essentially from private donations and then passed along to people in need. We have a kind of an unusual organization. We run 5 DMV offices in our area. That's our side hustle. And then we pay for all of our administrative costs with that money. And so all of our donations go straight to patients. We just talked about that. We do vouchers. This is a program we started in 2010. And so we'll do well over 1,000, usually closer to 1,200 vouchers every year. And we act as the insurance company to hospitals. So someone who doesn't have insurance, maybe they're underinsured, maybe they've never had a mammogram. They call us, we send them a voucher, we go to 400% of the poverty level. They take that in, and that's like their insurance card. So they can get an annual mammogram every year. We have, so I'm going to go over our main programs first. We'll do roughly 800,000 in direct client assistance every year. And that's in the Midwest here. We'll do a certain amount of that in Central Florida, and I'll get to that in just a second. We also have the mammogram program. We have a lymphedema program that we give out free lymphedema garments to anyone who needs them. And then we collect, we've gotten like $150,000 in bras and prosthetics in the last couple of years donated to us by hospital organizations. So we give that away free too. This last year, and this is not just women under 35, by the way. So that looks, I've been realizing we're misbranding everything during today's talk. So this will be people under 35. But in Missouri, there's a group called Show Me Healthy Women that pays for diagnostic services for women who have an issue that have to go in and get it checked out, not just a screening mammogram. Well, it only helps women over 35. So we got sick of taking calls for women under 35 and saying, sorry, we can't help you. you'll have to call another foundation, maybe with a hospital. So this year we started a new program aimed at them. And we expected, we got the funding first. We expected to help maybe 20 people, and we helped 19 in the first 6 months. So we've decided there's a need here, and we're going to be, we only did it as a pilot in Springfield. We're going to be rolling that out to the rest of our area, we hope, in the next year. We also started support groups this year. They kind of went away, as many of you know, during the pandemic. So we started some online and in person through a behavioral health hospital based in Springfield, both for caregivers and for breast cancer survivors. And we are just right now considering something. One of your early speakers talked about having a prophylactic surgery. And just this year, I've learned a new phrase, the whole pre-vivor term. So we have always been our mission-based for people going through breast cancer treatment to help them then. But Previvor is also something that we're considering now, being able to help people through. Essentially, we pay their bills while they're going through treatment, so they don't have to worry about that. I will tell you that this past year and a half, maybe, since we became associated with this organization, and specifically Peggy and her son, that men have been coming up a lot more in our conversation. I spent 25 years in television news, so I don't do anything without thinking about the bigger picture and promoting it. And we've been talking about, as part of our talking points on radio, and we do a monthly series on the NBC affiliate here about breast cancer, and men are part of the conversation. And I'm so proud that I'm the only guy here, but our women in the office are the ones who are driving this, because I had to be a little careful about that, having been the first male director here. But they have driven the conversation of incorporating men and changing the terminology to people and families impacted by breast cancer. So whereas historically we talked about our pink sisters and things like that, those terms have been changing for us. Our mission is changing. It's morphing a little bit. These are some of the things I told you about. But in the past couple of years, because of what we've seen on the national level, we've had to change a little bit. Some of you know that Komen pulled back from a chapter-based model into a national organization model about a year and a half ago. Well, in one of our areas in Northwest Arkansas, that meant that they lost some, I never have been able to figure out the actual amount, but it's over 100,000, 6 figures in direct assistance for people down there. So that just dried up overnight. Luckily, because of our business model, we're positioned that we can slide in there and hopefully take care of helping some of the need that was left when they left that area and kind of changed their model. ACS did the same thing when they went to one office per state, because we lost our office here in Springfield. We're disconnected from St. Louis and Kansas City, for those of you who don't know Missouri very well. So we've had to step up and form partnerships with other groups to do wig rooms, for instance, or help with lymphedema garments and things like that. So as we are doing that, we're engaging with new groups. And I talked about this at the beginning, Peggy, when I told you about this new group called the Missouri Breast Health Coalition, which, as far as I can tell, started with a group like ours out of St. Louis called Gateway to Hope, which also does financial assistance. So they are trying to map out all the resources available to people who need mammograms and people who have breast cancer in the state of Missouri. So we're all working together instead of all running in our own lane, because I think we're starting to mesh a little bit and overlap. So I'd love to introduce you guys to that group and have you join on the next call.
Absolutely.
Between that and I had our community outreach director go to Kansas City a week ago, and she attended the Komen legislative update. They had a conference for Missouri, Kansas up there, and you might not have been aware of that, I'm guessing. So there were only a handful of people there, and they said that they'll get 15 to 20 people in other states when they've done this. So our goal is to really collaborate, where in the past there's been a lot of maybe not a fight, but maybe a concern over the donor dollar, right? This has to be ours, not theirs. Well, I think there's a move afoot nationally. There certainly is here to flip the narrative and figure out how our programs can work together instead of worrying about the funding. So, so anyway, as we do this, as I said, I hope you can give me access to today's presentation, because for our radiologists and our oncologists and even my program director, who's an RN, there are some things in here I think that could really help them out. And I'll just end by saying that well, it's only been 7 years ago now, a friend of the family of Mary Beth had breast cancer in Lakeland, Florida, which is right in the middle of the state, right between Orlando and Tampa. And Mary Beth counseled her through that. So she wanted to start down there what we do here. So we run it. They raise the money. Since we're hyper local, they raise the money. We keep the money in the Bank of Central Florida, and then we process all those applications and help people. We don't do mammos down there, but we do financial assistance for Central Florida, ranging from, Daytona down to Vero Beach on the East Coast side, and then from south of Tampa to north of Tampa. So a big swath, 8 million people is the size of the group that we're helping, including Orlando there. And that's our biggest challenge right now. And I know there was a guy earlier today talking about his connections to DC.
Yes.
And I'd love to get connected with him, because that's something that we're knocking on some doors up there to try to get us able to help more people in Florida, because
that's Bill Harris and his son, who lobbies and does everything in DC. So we'll definitely connect you on that. But that's
us in a nutshell.
This is amazing knowledge, and we were lucky and fortunate enough to be part of your fashion show event when you brought the men out to let the world know there. And I didn't mention that. I should mention that to everybody. So we have one of our signature fundraisers. It's not our biggest money fundraiser, but it's really what we do. We have a fashion show for breast cancer survivors, and have always had women. And this year we decided to have men. So we added 5 guys to the stage, and they, thanks to Brett and some of his cohorts, they stole the show. And Brett, I don't know if you remember Jeffrey. I think he kind of had a beard. So he has been a part of fundraiser with firefighters down in his hometown. He went around with us to meet some healthcare partners in his area just 2 weeks ago. So he's been a part of the conversation with us and the outreach of what we do ever since.
Oh yeah, I've kept in touch with the other 3.
Yeah, Jeffrey, Derek,
and I've had Jeffrey. I got him hooked up with Cynthia Rogers. Cynthia, she does a podcast called Boob Talk, and she had reached out to me beginning of October, and she just wanted to get another male survivor that she hasn't, of our group that she hasn't reached out to, and Jeffrey was the first person that came to mind, and he was all for it. So it's been really empowering for him. And I have to tell you, I've only been here 3 years. I'm a little bit like Jay. I'm kind of a newbie, but this has really turned over a new leaf for BCFO. It's all we've been trying and stuff, is for all the men, is to realize that you don't have to hide behind the pink and everything. Like we can make it our own thing too, and get the support and the awareness out there. So thank you guys for all that you do.
Yeah, it's a people's disease, and
Joe, that was an excellent presentation. I'd love to follow up with you next week if possible. I'd love to pick your brain about how you've got such a wonderful advocacy group, how we can get advocacy groups like yours and more of you around the United States advocating for exercise. Now, what you said about what your medical oncologist said is true. Almost all the medical oncologists say, well, Mrs. Smith or Mr. Jones, you need to go exercise. The problem is most patients don't do it unless they're actually referred to programs. And even if it's Live Strong or whatever the 3 models are. But if you don't mind, I'm assuming I can find you online and we'll follow up with you. But I'd love to pick your educated brain about the advocacy groups like yours in promoting exercise for all cancer patients.
Well, and we, I think that is a piece of the puzzle that we don't often hear about, and it's an important part. And Jessica is my last year's board president. That's who I was texting with, and they're very active in our group, and we have a pretty tight knit organization down here, and we're very well connected to the healthcare providers in Joplin and Northwest Missouri and Joplin, or Northwest Arkansas and Springfield and all the communities throughout here. So that's our desire, is just to make it a more of a spider web, and if it helps more patients, we're in.
Yeah, and go ahead, Jay.
No, I was going to say, let me, Joe, because I don't know this. We all know about Colon. We all know about American Cancer Society. Is there a national organization of foundations like yours that are advocating for cancer patients?
So it's a little tricky. There's a group called the Pink Fund that's based in either, I think it's Minnesota or Michigan, but they are a nationwide assistance organization.
Okay.
But when you're talking about nationwide, we do $5,000 per family during treatment.
Sure.
So if you were to do that kind of assistance for somebody, and I'll tell you this, in Florida, $1,200, $1,500 rarely even covers the rent for a month.
No, I understand.
So
Yeah.
when you're talking about that kind of reach, nobody has that kind of ability.
Yeah.
So it's really about these local groups working together. Pink Fund, there's the one in St. Louis, there's some in Florida. We're very rare. And I came to this job with the thought of franchising, to use a business term, and just to be able to start. We find an activator, you find a Brett or a Mary Beth, or like we did Leah in Florida, and say, okay, here's how it works. Here's what we do. You hold a couple of fundraisers every year. We'll raise the money, and we'll find somebody. We'll get a committee of doctors and social workers, and they'll meet once a month. They decide how much we get, and then we just send the bills out.
Yeah. Well, good for you. Well,
that's oversimplification, but that's really all it is.
Very good. Thank you. Thank you very much.
And that's wonderful. And you were asking, all of this will be on our YouTube channel. I hopefully will have it done by mid next week, all the different recordings. So you'll be able to share your link with anybody you want. I will also share in an email with everyone that's been on here today. I will share your emails out back to each other within the group here that have been talking, and we will get that out, but also get all the videos out to everybody when they're done. But I will send this other, fairly quickly, so everybody can communicate with each other that need to connect. So any other questions we got?
Thanks for including me today.
Well, thank you for being part of it, man. This is what you guys are doing are amazing. It's just amazing to help out. So that's fantastic. Anybody else have any other questions here?
Joe, don't forget about me for next year. I'll do the fashion walk again.
You in?
Oh, absolutely.
He's been practicing.
That was fun. Kids will be a little bit older and everything, so we'll bring them down too.
Yeah.
We got to get that song on the catwalk for you guys.
Definitely.
See, I mean, I would. That's fine compared to It's Raining Men. I thought it was a joke when they first played it. And I go, is that actually? I was like, okay, no, that's what it is. I get it, but
yeah, that was priceless. And I know, I'll tell you what, and I'll do this if you guys want. I'll send because I'm sure everybody on the call would get a kick out of that. If I can find the video of that, I'll send that up to you guys.
It was excellent. Definitely very entertaining. But all right. So
I just wanted to say one of the fundraisers we have in Austin here for the catwalk is we have big companies in Austin make a bra. Okay, so they do jewels, they do gold, they do chains, they do all the, so they get pulled into coming because they want to see the bra on a patient, and the money that they bring in is millions of dollars in about 5 hours. So it's just, I just wanted to give you that little what they do here in Austin, if that should help with the imagination of, as you're building yours and reaching even more, it's a great way to pull everybody in. 'Cause
Yeah.
like big companies would come, like IBM would come in, a whole big, huge table. Why? Because they want to see their bra on a patient going down the catwalk.
And I'm not sure if
So-
that's how it works here, but they have one here in KC and they've done it for a few years, bra couture, I think. But it's along the same lines that they, you know, you design, you know, bra and everything, and you get the women to, you know, showcase and stuff.
They've invited you all.
Yes, they've invited. I think I think I had a conflict with work or something, or friend's wedding and stuff. But I know within this last year, one of our guys, Jason Knip, he did the walk and stuff, and he was all kind of dressed to nines and tuxedo and everything. He was out there for the walk and everything too.
Well, let me tell you, this came up this year. I'm sure a lot of you have heard of Branson, Missouri. So Branson used to hold an event for us every year, and they had all these bras that people had made, and they were blinged out, and they were quite a sight. So they gave them all to us, and I have a couple of survivors on my staff, and you know, you always have to be kind of sensitive to the most sensitive people out there. That's how I look at it. And when we got these bras, my survivors said, we're not doing anything with it. We're not using those. And they schooled me on how, for some survivors, a blinged out bra sexualizes the disease, and how that goes way overboard and is insensitive to a lot of women. So I get it. I mean, I can see how it's a big fundraiser, but boy, sometimes you just have to watch the tightrope you're walking on.
Yeah,
Didn't mean to kill the
absolutely.
conversation.
No, not at all.
I was going to say,
It
as
was an
I've learned a
interesting
long time
conversation.
ago, working at a country club, you're never going to please everybody. Somebody's always going to be upset about one thing that you do, and it's just, you have to just weigh your options. What's going to benefit the majority?
Yeah.
Well, to Sherry's point, if I could raise him 1 million,
Oh, absolutely.
Do it.
speed ahead.
They do it, but more importantly, it pulls in businesses that would never step foot in the fashion show because it's not in their space. But whenever anybody gets involved and creates something, then they want to go see it. And it was literally the game changer that we were all looking at, because what they use the money for is for the patients.
Mhm.
So it is the most powerful fundraiser we have in Austin, and Austin's pretty, you know, they're pretty active in most things in life, right? Austin, Texas is pretty busy. So I just wanted to share, even if you used your imagination for something else, but that was the way to pull in found money. Let's call it that.
Right. Well, I'm
Very
definitely gonna
true.
look both of those up, Bra Couture and the one in Austin. Just see what it is.
Yeah,
Yeah.
it's called Art Bra Austin.
Art Bra, thank you.
Okay.
Yeah.
Yeah, and you and Sherry, Joe, need to get connected too for all your women, and her recovery shirt would be amazing.
Well, I don't know if you saw my chat message to you, Sherry, but I already looked you up. So we're gonna probably at least buy one so I can get it in-house and show our program director to see if that's something that, you know, there are women that are women or men that are going through this, that they
Yeah.
would need something like that.
So no
that
need
could
to
be a part of
buy.
our client assistance.
Yeah, no need to buy. I'd be happy to, Peggy can connect us, and I'd
Yes.
be happy to give you a whole kit. I've got the shower pouch, the full kit,
It's
and the
amazing.
shirt. So the
Yeah.
whole kit has been about 150,000 proof of concept. So
I
I
appreciate
know
that,
it's not
but
gonna,
You
won't
have a
disappoint
business to run,
anybody.
so
Mhm.
I'm okay to buy that because we'll keep it in-house, and that'll be our like a model or something, because we have people come in all the time.
Okay.
Well,
that would be
yeah,
fun.
and with that, Sherry's going to talk, so stay on here because she has a lot to share, and not only as a survivor and someone that's been through it, but making something happen once she got hit with this disease.